I'm Morgan. I'm going to be your student nurse today. Are you experiencing any pain? Okay. If you could just say your name and date of birth.
Hannah Bone, 6/18/2003.
Okay. Patient looks alert, upright, pleasant, looks stated age. Okay. Today I'm going to be doing a thorax and lung exam on you, so I'm just going to be looking at your chest, your back, feeling your back, and then also listening to your lungs. Is that okay?
Yes.
Okay. And have you been experiencing any shortness of breath recently?
No.
Okay. Just going to start by looking. Right, ribs are sloping downward. There's a 1-to-2 ratio for AP to transverse, and everything looks symmetric. Patient is a tan color and is breathing effortlessly. Okay, now I'm going to feel your back. You just turn to the side. Okay. Patient is warm to the touch, is dry, smooth. Everything looks symmetrical. Was there any pain with that?
No.
Okay, there's no pain, and I did not feel any masses either. Right now, I'm gonna have you take a big, deep breath for me. Okay. Okay, chest expansion was symmetric. Now, I'm going to listen. And then if you could just breathe in and out through your mouth each time the stethoscope touches. Okay, turn to the side. All right, there was no adventitious breathing sounds. Do you have any questions for me?
No.
Okay.
Come in. Hi, my name's Anna. I'm going to be your student nurse today.
Hi.
How are you doing today?
Good, how are you?
That's good. Would you mind telling me your name and date of birth?
It's Emma Hilt, April 16th, 2002.
Okay. Are you having any pain today?
Mm-mm.
Do you have any history of COPD or are you having any difficult breathing right now?
No.
Okay. So general survey, my patient is upright, pale pink in color, conversational, looks her age. Okay, so I'm going to start by inspecting the anterior, posterior, and lateral chest.
Okay.
So, oh, my hands are full.
Yeah, you're fine.
Okay. And then There was no abnormal coloring, such as cyanosis. It looks symmetrical. The ratio is a 1:2 for anterior, posterior, and transverse. Did you have any tenderness?
Mm-mm.
Okay. I'm going to palpate your back here. Just let me know if there's any pain or tenderness. Oh, sorry.
You look cold.
Okay. No deformities, such as masses. No pain or tenderness. There's probably a lot more that I'm not saying. So I'm gonna check your chest expansion.
Okay.
My hands are cold, I know. Okay, will you just take one big breath in? Okay, so chest expansion is regular because my thumbs moved out symmetrically, so it's symmetrical. Now I'm going to listen to your lung sounds.
Okay.
And then every time my stethoscope touches, would you just take one big breath with just your mouth?
Yes.
Sorry.
No, you're fine.
Here we go. Okay. And I'm just gonna do your side here.
Oh,
sorry.
sorry. I got ahead of myself.
I'm gonna do right here. Sorry.
No, you're fine.
One big breath in.
I'm forgetting how to function right now.
Okay, and then if you could, actually I'm gonna do one more on your front side.
Okay.
Okay, sorry. Okay, and then if you could turn that way for me, please. Okay. Do you need a break or anything?
No, I'm okay.
Okay. Okay, and then you can turn back around. And then the lungs have clear sounds in all lobes. And then do you need anything else?
I'm okay.
Okay, so then I'd wash my hands. And thank you.
Come in. Hello, my name is Natalie. I'm going to be your student nurse today. How are you?
I'm good. How are you?
Good, thank you. Can I see your wristband?
Yeah.
Can you tell me your name and date of birth?
Harmony McCarter, 100302.
Perfect. And are you in any pain today?
Nope.
Okay. Do you have a history of asthma?
Yes, I do.
Okay. And then do you have a history of tobacco use?
Nope.
Okay. I'm going to be performing a thorax and lungs exam on you, where I'm going to be listening to your breath sounds and palpating your back. Is that okay?
Perfect.
Okay, let's get right into it then. I'm just going to inspect your anterior, lateral, posterior. Okay. Patient has anterior posterior to transverse is 1 to 2. Downward sloping ribs. Respiratory rate is normal, automatic. Patient is symmetric. And color is pale, pinkish. General cues. Patient is conversational, good hygiene, looks her stated age, dressed appropriately for the occasion, pale pinkish skin. Okay. Next, I'm going to be palpating your back. So, okay. Does this hurt anywhere?
No.
Okay. Okay. Patient is experiencing no pain or tenderness. Temperature is warm. Skin is dry, no masses. Okay. I'm now going to be testing for thoracic expansion. So if you could take a deep breath for me. Okay. And then one more time. Okay. Thoracic expansion is symmetric. Okay, I will now be listening for breath sounds. Okay. So every time I put my stethoscope, if you would just be able to take a deep breath for me. Sorry. Okay. And then if you could sit up for me. Okay. And then, sorry. Okay. Okay. And on this side. Okay, thank you. Breath sounds are clear in all lobes from left to right. Any other questions for me?
Nope.
Okay, thank you.
Thank you.
Hi. Hello, my name is Bella Workman. I'm going to be your student nurse today. How are you?
Good, how are you?
Good. I'm just going to check your wristband really quick. Can you say your name and date of birth for me?
Caitlin Scott, 12/18/02.
Okay, awesome. So today we're going to be doing a thorax and lung exam. So that means I'm going to be looking at your breathing, your respirations. I'm gonna use my stethoscope. Is that all okay with you?
Yep.
Okay, so first, general survey. Posture is upright. Patient is pink in color. Patient is attentive, alert, and conversive. And yeah, so first I'm gonna ask you, do you have any history of asthma or any other past respiratory problems, like past pneumonia infections or anything?
Nope.
All right, okay. We're gonna get started.
Okay.
So first, I'm just gonna inspect. So I'm just gonna take a little rounds, make sure I get all angles. So patient's chest is symmetric, and she has a shape of anterior to posterior 1 and then transverse 2, so the ratio is 1 to 2, so that looks good. And then her color is pink. There's no sign of cyanosis, which is good. And her respiratory effort is effortless, looks beautiful, and looks just relaxed and stable. So now I'm gonna have you turn around for me. So, oh, sorry. I'm going to just palpate the back. Or the posterior chest, I'm sorry. Okay, so there was no moisture, her skin was dry, everything looks symmetric, there's no deformities such as lumps or bumps or like bruising, and then do you have any pain at all anywhere, whenever, any of that? And just let me know if you have any pain throughout the assessment. Okay. Okay, and then I'm going to do chest expansion. So I'm going to locate where her belly button is and then go through there. And then take a deep breath in out for me. Alright, so patient has symmetric chest expansion. Her, whenever I have my thumbs, they expanded symmetrically and came back, so that looks good. And then now we're going to do a little listening. So every time I press my back, my stethoscope to your back, I want you to take a deep breath in through your mouth and a deep breath out through your mouth, okay? And let me know if you have A, any pain, or B, if you like need a break.
Okay.
Because you might get a little dizzy.
Breathe in for me. Alright, and then I'm just going to do it louder. Raise your arm for me. Breathe in. Alright, and then flip around for me. Give me a break, are you good? No, good.
Okay. Just checking. Such a good nurse. Okay. all lobes were clear. There was no adventitious breath sounds, such as crackling or wheezing. Everything looked good. Is there anything else I can do for you today? No. Well, here's your call. Thanks. And I hope you have a great day.
Thanks, you too.